Understand before actually we start emulsifying what are the anatomical facts of the eye and the nucleus. You need to understand your machine and a chopper, and you need to understand the removal techniques, steps and terminology of the nucleus removal. So if you see the nucleus anatomy, it is concave backwards. Why it is important? So that when you make a trench, it should be deep in the center as compared to the periphery. So make a trench according to the anatomy of the nucleus. And then there is a central safe zone. That means the area within the capsular axis and the pupil, there is a maximum space in the eye. Cornea is upwards and the capsule is backwards. So this is the area where all the phacoemulsification and aspiration should be performed. If you perform the phacoemulsification in the peripheral part, you are going to have a problem and a complication. So when we talk of the parameter settings, that depends upon what of the cornea it is, anterior chamber depth, pupil and iris, zonules, lens and a nucleus. So all these things, there is no standard set guidelines that these are the only parameters you should use. So depending upon the case to case, if the chamber is shallow, probably you need lower parameters. If the iris is floppy, you need lower parameters. If the patient is myopic, probably you need a less bottle height. So the parameter setting will be dynamic and depending upon the case. And also the setting will depend upon the type of the machine you have, whether you have got a third generation or fourth generation machine, and what experience you have and what technique you are going to adopt and which step of the surgery you are there. So when we talk of the vacuum, so vacuum is one which decides how much holding of the nucleus will be there. As we know, the force is vacuum into the area. That means if the tip size is 0.3 into 0.3 into 3.14 is 0.28. And if you make the tip size is just 0.45, the holding power becomes double. So that means wherever you need a very strong holding, you need a bigger opening. Like in a hard cataract, you need a regular tip instead of a micro tip. On the other hand, when you do irrigation aspiration, the tip size is very small, just 0.15, because you just need to suck it out. You don't have to really actually hold it. And the flow rate decides how fast the things will happen. Suppose you have preset a vacuum at 500, how fast it will reach there and how fast the things will follow towards the tip is decided by the flow rate. So the vacuum decides the holding power and the flow rate decides the flow rate. So depending upon, again, if you are removing the things which you don't need holding, like you are removing the epinuclear plate, a lower vacuum setting will work, but you need a good flow rate. So the techniques are basically divide and conquer, chopping, stop and chop. And the steps are trenching, you make a trench, splitting, chopping and aspiration. These are the standard, whatever may be the technique. So this is what is the divide and conquer technique, where we make 2 trenches and then divide the nucleus into 4 pieces. So this disadvantage of this technique was more phaco energy needed, more time consuming, and pieces were little too large. So then came the stop and chop. Actually, stop and chop came after the chopping, because in this we make a trench, then stop doing the divide and conquer and go and chop the nuclear pieces. This is what is called a stop and chop technique. When we are talking of the chopping, we need to understand one term which we call as a vacuum seal. That means you bury the nucleus tip in tip of the phaco machine into the nucleus, build up the vacuum and hold the nucleus over there on the tip by creating a seal, vacuum seal over there, and then you can make a central chop. That means when you do not negotiate your chopper underneath the rexus margin, just at the center you vertically push the chopper down, it is called central chop. Peripheral or horizontal chop is when you negotiate your chopper underneath the rexus margin, go to the periphery of the nucleus and then start the chopping. Peripheral chop is much stronger as compared to the central chop, but at the same time there is a little more maneuvering is required. And then there is a modified peripheral chop. Instead of negotiating chopper to the periphery of the nucleus. You pull the periphery of the nucleus out of the rhexis margin and start the chopping from the periphery. And then there is a direct chop. When you do not make any trench, just bury the nucleus with a high vacuum setting and start chopping. So when we do the vacuum seal, NUS at the central part of the nucleus, give little bit of energy. Once the tip goes in, bring the foot pedal position to and hold over there. So when we do the peripheral chop or the horizontal chop, you can see my phaco tip is lying here. The chopper has gone to the periphery, and then we start the chopping from the periphery. I already explained what central chop is. Thank you for your